Before we start our procedure, we must introduce ourselves to our client or to our patient. Good afternoon, ma'am. I am Shane Convergi Pangilinan, your student nurse for today. After introducing, we must verify identity using three identifiers, name, age, and birthday. We must check first our patient chart, and we must ask our patient to confirm their identity. May I confirm your name?
Regina Gambo,
How old are you?
45,
And birthday?
940.
Okay, thank you po. And after verifying the identity, we must check also their wristband. May I, ma'am? After checking the wristband and verifying the identity, we must verify the doctor's order for type of moist heat application, location, duration, and desired temperature. After that, after verifying the doctor's order, we must review the patient chart for confirmation and correct patient and correct procedure. After checking the chart, we must assess the skin for temperature and the area that need to be treated and the sensitivity sensation of the patient. After assessing, we must inspect the wound for size, color, discoloration, or sensitivity and odor and tenderness and drainage of the wound. After inspecting the wound, we must assess the awareness for the client and for her family members. Ma'am, I will do the hot complication of hot compress. Are you okay with that? Okay. After assessing the client's awareness and family members, we must assess the vital signs and mobility of the patient. Okay. While waiting, we must assess for the mobility of the patient. Are you comfortable to move, ma'am? Are you okay with that? Are you able to walk properly, to move properly? After assessing the vital signs and mobility of the patient, we must identify the expected outcomes. The expected outcomes, the patient must less in pain and stiffness due to hot application of hot compress. And after that, we must explain the procedure to our patient or to our client to ease the anxiety or fear of the patient. Ma'am, for today, I will apply a hot compress to your wound to reduce the pain or decrease the pain and the stiffness from your wound. Is that okay with you, ma'am? Okay. We must also need the completely approval of the clients before we start the procedure. After explaining the procedure and get the approval of the clients or patient, we must describe the sensations to our patient or to our client to avoid confusion or fear of the patient. Ma'am, the sensation you might feel during the hot compression, you might feel mild prickling feeling and mild warm to your wound po. Is that okay? After describe the sensations, we must provide privacy during the entire procedure. So I will close the curtain now. And if possible, you must close the door also. And after that, we must position the clients in comfortable position. You are already comfortable in that position now? After putting the patient in comfortable position, we must do the hand hygiene and wear clean gloves. After doing the hand hygiene and wear clean gloves, I will place a towel underneath the patient's arm. placing the towel in the patient arm, we must apply the hot compress and make sure it is the desired temperature for the hot compression, and avoid too hot water to avoid burning sensation to the client. In 10 to 15 minutes, the applying of hot compression, and stop if the patient is uncomfortable or there is a problem or burning sensation to the patient or to the client, and inspect the wound for effectiveness and check regularly to avoid further injury for the patient. After inspecting or checking regularly for effectiveness, we must ask the patient to describe the level of comfort and pain that the client might feel. Ma'am, the 1 is the lowest and 10 is the highest. Can you describe the level of comfortable feeling? 9. And what about the level of pain? 1. Okay, thank you. And after describing the level of the client, we must identify again the expected outcomes. After the application of hot compress, you must feel less pain and stiffness from your wound and from your feeling that might you feel during the procedure. Okay. And next is document, and after that we must remove the hot compression after 10 to 15 minutes or the desired duration from the doctor's order. After that, we must remove the clean gloves, and do hand hygiene again. And after that, we must document the entire procedure, and report if there is any problem occur. Introducing ourselves to our client or to our patient and verify the identity and verify the doctor's order, review the patient chart, assess the skin, and inspect the wound, and assess awareness for the client and for her family members, and assess vital signs or mobility of the patient, and identify the expected outcomes, and preparing the equipments, and explain the procedure, and ready the equipments again, and make sure that it is complete, and describe the sensations that the patient might feel during the procedure, and provide privacy, close the curtains or the door if possible, and position the client in comfortable position, and do hand hygiene and wear clean gloves, and then place a towel underneath the patient arm or the area that need to be treated. After placing a towel, we must apply the cold compress. Make sure it is covered using cloth or towel. And the desired duration for this cold application must from the doctor's order, and stop the procedure if the patient is already uncomfortable or if there are any problem that may occur, and inspect the wound regularly for effectively. Okay. After that, we must ask the patient to describe the level of comfortable feeling and pain. 1 is the lowest, mom, and 10 is the highest. Can you describe the level of comfortable feeling?
Right.
9. What about the level of pain?
What?
1. Okay, thank you. And after that, we must obtain the vital signs again and identify the expected outcomes. After this, the patient will reduce the pain, and the patient will feel less pain after this cold compression. And after that, we must document, but we need to remove first after the desired duration of the cold compress application. And wipe. After that, we must remove our gloves. After removing our gloves, we must dispose, and we must document the findings, or if any problem perceived, we must report it immediately.